For those who have been wondering if the United States has universal health care, the answer is no. The United States is actually one of the top 25 wealthiest countries in the world, ranking at number 11, but does not offer free healthcare to the citizens. But like, why is that? So universal healthcare is one of the leading causes of bankruptcy in the United States due to the high medical bills that patients have received and get every time after their surgery. And then about 66.5% of bankruptcies were all medical related. An estimated about 530,000 families turn to bankruptcy each year because of medical issues and bills. And sometimes the insurance cannot cover all of it, so that's why some people they can't pay off the insurance in time. And then so how does the healthcare get in the United States? So the Affordable Care Act was a law in 2010 that was established by the Medicaid to help make coverage more affordable to the citizens in the U.S. The health insurance that is offered in the United States can either come in a group plan or individual plan that the citizens choose that best fits them. Sometimes jobs offer them at a cheaper price for the individuals, for their family, and elsewhere. And also, insurance plans can sometimes be cheaper and can benefit you the most throughout.
Switching topics on what Jordan has previously discussed, I will now be discussing what is universal health care. Universal health care is when insurance is provided for every citizen in that specific country. And it makes sure that everyone has access to medical care when needed, and it has equal access. So it does not matter if you are poor or rich. There are 3 different types of universal health care. It is single-payer system, socialized system, and private insurance. A single-payer system is when the government still gives everyone health insurance, but doctors and hospitals are still private businesses, and it's your choice to choose what hospital or doctor you want to go to. Socialized medicine is when all the hospitals are owned by the government, and the doctors and nurses will also be government employees. It does cost more than socialized medicine. The health cost for single-payer system is covered by the tax revenue used by the government. Private insurance is when the government regulates that everyone needs some type of health insurance. This is the person's choice on which insurance to get, but it's also the most expensive. Some countries also have a type of 2-tier system where that country has a regular health care available for everyone, while also having a second type of health care for those who can afford more expensive insurance. There are 33 developed countries in the world. 32 of those countries have universal health care. The one country that does not is the United States. One of the countries that does have universal health care is Japan. They have a different way of a system that is set up where they have statutory health insurance system. Japan has their citizens enrolled in the coverage where they will have to pay for the statutory health insurance system, although they can still choose to buy private health insurance as well. Another country is Germany, also runs as a non-single taxpayer model. Their system is that everyone has to have health coverage, and some employees already are enrolled in that automatically. They also let their citizens choose if they want private health insurance. Another country is the United Kingdom. They go by the single-payer system. So they also have socialized medicine system as well, and that's where I have previously talked about the 2-tier system, so that is one of the countries that has that. And they have the single-payer system and socialized medicine system as well, because the government does own most of the hospitals already, and they already hire the employees for the hospitals. They also have the option for private health insurance if the citizens want a faster access to care. Those 3 countries that I have talked about are also the most developed countries economically in the world. The reason that they are the most developed country economically in the world is because they have a healthy population due to universal health care. Having a healthy population means having a better economy, and therefore there are going to be more productive workers, which will increase the productivity there is needed to have a good economy.
The United States entered what could in many ways be considered a trial run for universal health care in March of 2010 with the signing of the Patient Protection and Affordable Care Act. Commonly known as Obamacare, the act sought to increase access to health care for low-income individuals and families, and it did this in a few different ways. Firstly, it placed many new regulations and restrictions on the private health insurance companies. For example, insurance companies were no longer allowed to refuse to cover somebody if they have a pre-existing medical condition, which used to happen quite a lot and would leave particularly vulnerable people without medical coverage. Insurance companies were also required to cover the children of their policyholders until they reached the age of 26. Aside from further regulating health insurance companies, Obamacare also provided subsidies for people with income below a certain level. Those subsidies could then be used to purchase health insurance from one of the private companies. However, for many people today, the word Obamacare evokes more memories of the political debate surrounding it than of the act itself. Obamacare faced opposition from both sides of the political aisle, and this opposition wasn't exactly unwarranted. Many people took issue with a part of the act that required by law that everyone get health insurance from one of the private insurance companies, or face a fine. The logic behind this was that if everyone has health insurance, they're more likely to get small health issues resolved before they grow into something bigger and more costly. Now, while this makes sense, many people didn't like the idea of being forced to pay for something from a private company. Another big criticism of Obamacare stemmed from its requiring of health insurance companies to cover those with pre-existing conditions. Since those people cost more to insure, the companies raised the premiums of all of their customers to make up for it. This was obviously unpopular with the customers without pre-existing medical conditions, who now had their premiums raised in order to account for the people with pre-existing conditions. Now, since the goals of Obamacare and universal health care are very similar, it's often easy to think of them as the same system. This has often led to the shortcomings of Obamacare being used in the case against universal health care. While they both aim to solve the problem of providing health care to low-income people, they go about doing it in completely different ways. Obamacare can best be thought of as a supplement to our current healthcare system, while universal health care is more like a complete overhaul of the entire system. The biggest and most important difference between universal health care and Obamacare is their utilization of private insurance companies. Obamacare placed more restrictions and regulations on private insurance companies than they had before, but they ultimately still retain them as the method through which people pay for their health care. On the other hand, a universal healthcare system does away with private insurance companies, and instead everyone has their health care paid for by the government. The elimination of private insurance companies from the equation altogether would actually minimize or eliminate entirely many of the criticisms of Obamacare. For instance, since the pool of insurance holders is the entire population of the country instead of just the customers of one company, they're in a much better position to negotiate lower prices for medicine and treatment. This would effectively combat any price increases stemming from treating those with pre-existing conditions, which was one of the main criticisms of Obamacare. Under a universal healthcare system, people also wouldn't be required by law to pay money to private insurance companies. They would instead simply be required to pay their taxes, which most Americans are already accustomed to doing and would likely be easier to stomach than being forced to give your money to a private company. In short, Obamacare and universal healthcare have several key differences that would enable a universal healthcare system to be much more successful in the long run.
So, who supports universal healthcare? There are U.S. politicians who do support universal healthcare. The U.S. politician who is the biggest supporter of universal healthcare is Senator Bernie Sanders. He's basically the face of the movement, and he holds a lot of influence and is always advocating for universal healthcare. In 2017, Bernie Sanders introduced a bill that he made called Medicare for All. In the bill, it states that the funding should come from the government spending $2 trillion. Raising taxes on income over $250,000 and reaching a 52% marginal tax rate on income over $10 million. The majority of the funding for universal healthcare would come from the rich and from the upper middle class, and which makes logical sense since they make more money than the working class and lower middle class. And the government funding will also take up majority of the funding for universal health care. So more on Bernie's plan and the attempts of other politicians to set up universal health care. So according to Bernie, his bill will help save $2 trillion because it will cut the spending spent on the paperwork handled by the medical insurance industry. Bernie thinks that a lot of the money is spent on just handling the paperwork instead of actually providing health care to the people, and that if people can access preventative care sooner, then that means they can get checked sooner for potential diseases and stop them from getting severely sick. And so the U.S. has a market-based system for health insurance, which is technically run by private insurance companies who set very high premiums for customers. And the people who don't benefit are the working class and the lower middle class because they can't afford these high premiums because they just don't get paid enough to be able to afford these premiums. And a lot of times people have to pay the premiums or the deductibles before they can even access their health care. And as many as 19 governors have attempted to set up a universal healthcare system in their state, with over 10,000 bills being introduced. This just shows how big of a problem we have with our current healthcare system that isn't providing insurance for millions of people, and that governors have tried to fix it so they can give their people health insurance. So, what does the reform need to have? The reform needs to provide health care. Like I stated before, a lot of these insurance companies don't let customers access their healthcare provider after they pay their premiums. And it also needs to completely reform the healthcare system and end incentives for costly expenditures, to reform the market-based insurance system, and to push insurers to pursue high-end insurance options for non-covered conditions, to reduce administrative waste, to align patient needs with the activities of healthcare organizations and provider. So, in order to reform the current healthcare system, we need to completely eradicate and put a one-based healthcare system in place. And that system should be the government. And the government would provide everyone with healthcare, no matter if you're rich, poor, middle class, no matter your ethnicity. It would just provide everyone with health care, which is a universal right.